So some of them, like for example, a lot of times nursing will come and need to weigh the patient or take them to the restroom or do a treatment, and it just really depends on the patient. So if let's say that restorative nursing came and they needed to weigh them, a lot of times I can take a look at my goals or think about what goals I'm working with, and I can actually treat my patient in a functional setting. I can see, are they following commands? Are they able to sequence what they're being asked to do? Are they comprehending? Do they have insight? So in those situations when I'm interrupted by nursing, I'll try to utilize the goals that I have set for them. If it's, I don't know, an unforeseen thing such as a shower that I can't participate in, I'll just check my schedule and, try to, flop some patients. But the most important thing I can say is I have that built-in time at the end of my day, which I always try to have built in for unforeseen things. And if my productivity is bad that day, then that's just where I try to play makeup the rest of the week.
Yeah, if it's something that I can do with the patient that is interrupting it, I'll go ahead and try to just incorporate it in my session. So if nursing needs a weight on a patient, say, I'll walk them down to the scale and then I'll give you the weight, or we will, they need to get up for something, can I go ahead and train you on the transfer and make that part of our session?
So one of the things that I learned early on as a therapist that was been really effective for me in terms of managing my billable time is really working to manage the expectations on my patients and their families from the get-go. So on evaluation, sitting down and explaining, and sometimes you have to revisit the conversation throughout the plan of care, but explaining about their time. My time with you is your time, and it's dedicated to you. And throughout the day, I have other folks, and they have their time of my day. And so when we need to have a conversation about your care or your mom's care or your dad's care, we want to make sure it's during your mom's time. Otherwise, if we're trying to do that outside of that, then we're taking away from someone else's time. And just like you wouldn't want me to take time away from your mom's time to work on someone else, we need to be respectful of each of those folks as well. And people usually respond very well to that. They understand, and sometimes you have to reset those limits again. The person may still come talk to you during a time that's not their mom's time, and just reminding them, hey, I see your mom tomorrow at 11. Is that a good time for us to talk about this? Or do we need to look at a different time tomorrow? I'd be happy to do that, but we need to make sure that we schedule these conversations during your mom's time. Is really helpful. And once again, people tend to be pretty respectful of that if you explain why.